Welcome. Good evening, everyone. Dr. Scott Stoll, co-founder of the Plantrician Project. I am so delighted that you're joining us this evening. I've got my ginger turmeric tea, and we have Dr. Will Bulsiewicz in the house, and we're going to have a fabulous evening. And for all of us, I know you two have so many questions about gut health, and we have brought in the expert to answer our questions this evening. Will is also going to be at the Plant-Based Nutrition Healthcare Conference. He's back again this year. And if you're not joining us, you want to be there. It's great to get online education, but what's even better is to join with like-minded people in person, have the education, share a meal around the table, have a cup of tea, a conversation, get a hug. There's nothing better. And in this day and age, I think that connection is critical. Education is wonderful, but connecting with like-minded people is critical for all of us. And so please join us September 5th through the 8th in beautiful Desert Palms. We're at the JW Marriott, which is a fabulous resort. And I hope you join us there, pbnhc.com. So this evening, as you all know, because so many people have signed up and joined us, we are joined by my good friend, Dr. Will Bulsiewicz, Gut Health MD. He is an award-winning gastroenterologist, internationally recognized gut health expert, author of the New York Times bestseller, Fiber Fueled, medical director of Zoe, and has an amazing, background. Graduated from Vanderbilt, which is just up the road from me here in Tennessee, Georgetown Northwestern, and then residency and fellowship at University of North Carolina. Tar Heels, right? Now he lives in South Carolina with his wife and family, and is just transitioning all of the stuff over to Gut Health MD. So you want to make sure that you go there. And Will, you can't set some of these things up, but today in my practice, I had a patient that came to see me, and she said, "You'll never guess what." She said, "This product changed my life."
Oh my gosh.
She said, "I had decades of IBS." And she said, "I used this for 1 year and it has radically transformed my life." So she said,
Wow.
"I see that you're talking to Dr. Bulsiewicz tonight. So tell him thank you, because this product has made all the difference in my life." And this is your product, right? 38 Terra that you put together. And so, at the outset, I didn't mean to make this commercial. I just wanted to appreciate you and let people know that what you've done is really valuable. And then, it's really a prebiotic, right, on the back with some botanicals. So maybe just at the outset, just tell us a little bit about this, because it was so relevant to today.
Well, that's very kind of you to say that. And honestly, what you just shared there was the reason why I decided to create a company to create better gut health supplements. And so I guess the short story, and again, I don't want to focus on that. I want to get into questions. I
Yeah.
want to help people answer as much as possible. But the short story is that, in clinical practice, my approach is diet should come first, and that's what we're going to focus on. So this is not something that allows you to bypass diet. This is not a shortcut, but diet comes first. But we're all going to do our best with diet, and yet there will still be some of us who need more than that. And I see supplementation as an opportunity for optimization, and to address the things that our body really needs that maybe we're missing. And the beauty of GI as a field is that if something's working, you feel better, you can feel the difference. And so I used prebiotic fiber supplements for many years in my clinic. We can talk about some of them, and I'm happy to talk about what's out there and available. But then when Fiber Fuels came out, I had so many people that would ask me, "Hey, which one do you recommend?" And the problem is, I wasn't comfortable with the idea of putting my name behind what's out there. Part of it is I think that it's outdated science. These are products that were developed when I was a kid back in the 80s. And part of it is that there's no transparency. And I can't tell you with clarity whether there's, any pesticide residues or heavy metal issues, and you go down the line, there's many different things that are possibilities. So the point from my perspective was, you know what, here is an opportunity to do something that's different. My platform has been about education. I love that. I also love when people read my books and tell me that they found value in them. But also to develop what I consider to be a superior product. and bring it into the market, and then to have that product make a difference in people's lives because it's available. Like that's the reason why I created the company. So, and if people want to learn more, they can certainly go to the website, but I don't want to make it about 38 Tera. You know, it's there, and then let's talk about everything else too.
Yeah, thank you, Will. That's wonderful. And for those of you watching, in the bottom of your Zoom window, there's a button that says more. If you push the button, you'll see a Q&A bubble that pops up. And for any questions that you have for Will, you can put those in the Q&A bubble. I'll be monitoring that. And, in the next hour and 10 minutes or so, we will get through as many questions as possible. And I am fully anticipating, Will, that, this topic, more than almost any other, will have an unlimited queue of questions that start rolling in. Because really, still at the core, we don't know that much about the microbiome, right? And so there's so much to learn, and it is so critical to every part of our existence. One thing I learned, interestingly, this year, is the microbiome also can be found inside of joints. For a long time, we thought that joints were aseptic and sterile space, and now we're realizing that no, the microbiome, through different mechanisms, finds its way into our joints and populates the joint space.
Yeah.
And based upon the quality and types of those bacteria, can support cartilage or actually erode the cartilage inside the joint.
Yeah. We think of parts of our body as being sterile. And yet, I would make the argument that the only sterility that really exists in the world is when humans have created chemical products that make them sterile. So the body is not inherently sterile. There may be a wildly reduced bacterial load. In other words, basically what I'm saying is that you might not have very many bacteria in many of these places, but yet there are still bacteria. There is still a microbiome that's a part of these places. And an interesting one that came up. So we have several hundred people who are here. So open up the chat and give me a yes in the chat if you saw the Rich Roll episode that I did in 2022. And the reason up is because we had a conversation that there was new science, Scott, that had just come out saying that tumors have a microbiome. And that, in fact, the microbiome of a tumor is predictive of the response to chemotherapy on a certain level. And what they found is that, Scott, I feel relate to this because you understand, like with medical oncology, when we're talking about a cancer, different types of cancers look different under a microscope. And sometimes the cells are closer to human cells, and sometimes they're like very, very wildly different. And the more sort of disturbed the pattern is, where it's like really different from human cells, usually that's indicative of a more aggressive cancer. And so, in the same sort of vein with the microbiome, what they found is that when the microbiome of the tumor was disturbed, which we use the term dysbiosis, they discovered that actually dysbiosis of this tumor microbiome is associated with a poor response to chemotherapy. So it's interesting because, this is the way that I would characterize microbiome science is that there's been a period of 15, 20 years where we have just been kind of creating observations. And now we're moving into this new phase that I think is really exciting, which is about manipulation. How do we change the microbiome to get it in our favor so that we can get better health results? It's an exciting time, especially for people like us who are plant-based, because there's this natural this natural connection between plants in our diet and the microbiome, and we'll unpack that in more detail.
And especially exciting for those of us that are a bit of nerds, right? I know you're a self-proclaimed nerd, and I am too. And diving into all of this interesting science and transcriptomes and all these things is just it's wonder. And I can get lost in that science like you for hours, right?
Oh yeah. No, it's I spent so much time nerding out on science. And frankly, that's how this all started for me, was that I had my own health transformation. So I was in my early 30s, and I was 50 pounds overweight. I had high blood pressure, high cholesterol. I was very anxious. I was depressed and had really, really low self-esteem, like shockingly low considering that I was the chief medical resident at Northwestern, and I had like all these great things happening in my career. So if you knew me on paper, you would think everything was going well. But if you knew me in person, you knew that was not the case. And I tried to exercise my way out of it, Scott, being like a
Mm.
single male in my early 30s, and it didn't work. And that's not to diminish exercise. Exercise is very important. But by itself, it didn't get the job done. And then my life changed when I just started making smoothies. And like that by itself, I could feel the difference instantly. And so, this concept of nerding out, when my life and my health was radically transformed through the power of plants and a high fiber diet, when that happened, I didn't understand, even though I had gone through medical school and my internal medicine training and I was a GI fellow. I didn't understand. I wasn't provided with the education that I needed to make that connection. Why did this work? I knew it worked, but why? And so I was spending a lot of time at night reading the literature, educating myself to try to sort out like what is the deal here. And where it ultimately led me is like in 2014, there were microbiome studies that started to emerge in the medical literature that I could see, oh wow, they're right there. That's the explanation. This is why my health was transformed. And so I decided to bring that into the clinic in the way that I treated my patients as a gastroenterologist.
Wow. Yeah, that's powerful. And so you've been a part of the literature since the very beginning, and you've seen this evolution, which is really powerful. I think that that kind of, long view of science is really important.
Yeah, I think so. I mean, I celebrate the fact that gut health has become trendy. Um, I celebrate that because I love the fact that this was like when I started talking about this back, publicly in 2016, it was sort of a fringe topic. I didn't see it as fringe. There were studies to back up every single thing that I was putting out there. But I think it's great that now like this has gone mainstream and so people are hungry. And that's a beautiful thing because
Mhm.
like at the end of the day, what people like you and I want to do is we want to provide education and empowerment that leads to personal transformation and improves people's lives, improves their health. And it's hard to say to a person, eat, eat this, eat more plants, right? And not really have some sort of connection of why. This is why you need to eat more plants. And so the beautiful thing is I kind of feel like what was a black box, like we've shined a light into the black box, right? And where now we can say, okay, you have a gut microbiome. Your gut microbiome thrives on high fiber foods. And this is the reason why you need to be eating these foods. And it leads to this functional outcome that you and I have been looking for, which is that people eat more fiber, people consume more plant-based foods. They may be doing it for their gut health, but all of a sudden it starts nourishing their entire body. And all of a sudden you just see like these transformations that take place. And this is so we reach our goal by doing that.
Yeah, that is beautiful. And curiosity opens the door to that information. And we have a lot of curious people with a lot of questions already. So I'm going to start jumping. We've got 17 and the queue keeps getting longer. So um, let's see. I think I'll start with this one. Somebody asked, I try to maximize botanic, prebiotic, and polyphenolic dietary diversity, eating both raw and steamed vegetables. Are you able to comment on which plant polyphenols are more bioavailable with heating and cooking? And then secondarily, like ORAC values, how much is enough with these polyphenols?
These are quite specific questions, and I haven't seen a study to date. So I think let's zoom out for a quick moment. Really, the question is centering about polyphenols. And I think that we have to start by explaining what that is. So polyphenols are plant-based compounds. They come from plants. If you find them anywhere else, they started from plants. And these are plant-based compounds that, in the case of the plants, they actually may be using them as defense chemicals. But in the case of us as humans, they are antioxidant, anti-inflammatory, and they are prebiotic, which means that they are good for our gut microbiome. Prebiotic is a term that means food for the gut microbiome. So there was a study called the MAPLE trial, Scott, And in the Maple trial, they took a look at specifically a high polyphenol diet. So what that really means is eating a mix of different colorful plant-based foods and getting as many of them as possible in your diet. And what they found is will have benefits in terms of their gut microbiome, in terms of their gut health, and other outcome measures. So that by itself says to us, okay, there's benefit to these polyphenols. Do we need to get specific about which ones do well with heat, or which ones are better taken, for example, with fat? Because there are some that are better like this. From my perspective, I like simplicity. I like simple rules. I like to say, you know what? Even though I was a chemistry major in college, it's I feel like I could end up in the weeds and get lost if I get too technical. And so I prefer to sort of step back and say, like, if we're keeping this simple, I want variety. I want variety, but I also want to make sure that variety is not just like 10 types of beans, although I love beans. It also means different colors. And if you get different colors, these polyphenols, they tend to sort of um, aggregate around specific colors. Certain families of polyphenols form certain colors. So if you just quite simply eat the rainbow, you will be facilitating and accomplishing this. So that's the way that I would approach this. I don't have like a clear-cut answer to which one specifically. There are 8,000 polyphenols, and out of 8,000, 7,950 we know very little about. So, and then how much is enough in terms of ORAC values? I'm of the frame of mind. So I guess let me say, first of all, is there such a thing as too much? And I think the answer to that question is your body will give you the feedback that you're looking for. There is such a thing as too much fiber. And yet, the amount of fiber in our diet can be gently progressed over time for the vast majority of us. And so I think that when it comes to this, like how much is enough, my goal would be to not take and to be focusing on a diet that it like really is built around these types of foods. And I guess the last thing that I'll say on this is like I'm of the belief, if you've read my first book, you know one of my favorite sayings is progress over perfection. Let's not put too much pressure on ourselves to the point that we're not having fun, we're not savoring the flavor, we're not passionate about our food. Like let's maintain the fact that yes, food is for health, but also I love food. It's delicious. It's meant to be enjoyed, and that should be an important part of your life.
Yeah, that's exactly right. It is. I love that. It's about the bigger picture.
Yeah.
And enjoying your food, and then the diversity naturally follows when you're looking for those delicious meals. So, okay, we have a couple questions on SIBO. And so maybe if you can just briefly talk about SIBO. This, one of the questions is, can they still take the 38 Tera if they have SIBO? But maybe just talk about SIBO approaches, currently in the allopathic system, and then maybe how you approach SIBO and rebuilding the gut.
Yeah, there is a difference between the way that I approach this issue and the way that most gastroenterologists will approach this issue, and I would love to explain that. So, SIBO is an acronym, SIBO, and it stands for small intestine bacterial overgrowth. And basically, what this means is that we are growing more bacteria in a place where we're not supposed to really be seeing too many of them. The small intestine is not the location where bacteria concentrate. They're supposed to be concentrating in our colon. And so when they show up in the small intestine, they can be disruptive. They could throw off your gut motility, which might lead to diarrhea or may lead to constipation. They can get access to nutrients in your diet earlier than they're supposed to, and they'll ferment those foods. And when they ferment those foods, which by the way is not a bad thing, but it will produce gas, and it can cause discomfort as a result of the fact that this fermentation is happening upstream from where it's supposed to be taking place. And many people who have SIBO, they also can get sensitivity, where there's something that we call visceral hypersensitivity, where the nerves that are inside the gut are reacting to things that they shouldn't be reacting to. So, all right, so the problem on like a simplistic level is too many bacteria. And what this has led to is an excessively simplistic approach, which is, therefore, most doctors say take antibiotics. And the problem that exists with this approach is that if I wanted to medically induce a damaged gut microbiome as quickly as possible, I know what I would reach for. It would be antibiotics, right? There is nothing that will tear down the microbiome faster. And so if the root of the issue is a damaged gut microbiome, which is what I would argue this is, the root of the problem is a damaged gut microbiome, then to take antibiotics is only to inflict further harm. You're potentially making the problem worse. Now, I will acknowledge real quick that many people who have SIBO, they take the antibiotic, they feel better while they're taking the antibiotic. Yes, they do. That actually doesn't indicate to me that you've identified the solution. Instead, what that indicates to me is basically the bacteria that were being disruptive, you've just completely suppressed the bacteria. And by completely suppressing the bacteria, you don't feel symptoms on a temporary basis, but there's a price that is paid for that with what you're doing to the microbiome in terms of the long view, the big picture. So rather than destroying, I'm of the belief that we should be building. We should be empowering the good guys and cultivating the beneficial bacteria, because when we cultivate the good guys and get more of them, they're able to suppress the bad guys and address these issues for us, restoring motility, addressing that sensitivity of the gut, getting fermentation to work the way that it's supposed to so you don't feel gassy and bloated. So, and part of the way that you can approach this is with fiber. And there was a study that was published in Nature Microbiology a few years ago, Scott. And it was interesting because it challenged it completely challenged the approach that is conventionally used to address this problem in healthcare. Because what it showed is that people who were increasing their fiber actually had resolution of their symptoms and improvement, whereas people who were taking antibiotics actually had worsening of the issue. So, last thing I want to say on this, and I think this is an important point. I am not making an argument that if you feel unwell, that you should just tough it out. That is certainly not what I'm saying. If food makes you feel unwell, number one, we need to address that. But number two, there are ways in which to heal your gut that have nothing to do with food, like sleep and exercise and circadian rhythm, on some level fasting and human connection and spiritual connection. And these are things that in many cases we have our culture, we have lost. And if on an individual basis, it's not to say that every single one of these things are an issue for all of us, but I think that we need to do a legit look in the mirror and ask the question, where are my opportunities? What can I do? And among these things, the one or two that you see as an opportunity, let's try it. And you may see that it improves your symptoms.
Yeah, that's beautiful. Thank you for pointing that out. Because it's exactly right. All of those work through multiple systems in our body to reorganize our gut microbiome. And, I've had patients, as you have as well, you're working with the diet and they're still struggling because they have massive stress that's impacting cortisol and disrupting their gut microbiome. So you're right. It is that, addressing some of those important aspects of lifestyle too.
Yeah.
And kind of along that same line with antibiotics, there was a question that I think is a nice dovetail into this conversation about, somebody's saying they had tick-borne illness and doxycycline and now persistent diarrhea because of that disruption of the microbiome. So if somebody has experienced that, what can they do to rebuild their microbiome after an assault of maybe necessary antibiotics?
Yeah. So antibiotics, the common question that I got is like, how do I protect my gut with antibiotics? That's basically what the question is here. And the first thing that this story, which is in the question and answer box about getting exposed to a tick and needing the antibiotic, that sounds completely legit. But we must be aware that it's been estimated that 70% of the prescriptions for antibiotics in the United States are unnecessary. So I think it's completely fair game. Scott, you tell me how you feel about this. If a patient asks, like nice in a very gentle, kind way, what happens if I don't take this antibiotic? Do I absolutely need this antibiotic? Is that a fair question for a patient to ask you?
Yeah, it's a very fair question.
And I think being an advocate for your own health, and asking a question about because sometimes I think doctors they give the antibiotic because they think that that's what you want. So a very gentle, not necessarily challenge, but just kind of a question, can help to make sure that it's really necessary. So now, if you're taking an antibiotic, a few things I would love for people to already be eating a high fiber diet before you ever need the antibiotic. So that to me is like the homework for all of us as we sit here today is don't wait until you need it. Let's start right now. The more you build your gut microbiome up, the stronger and more resilient it will be in the event that you do need antibiotics. A prebiotic fiber supplement can definitely be helpful in this context. And it doesn't have to be 38 tera DMN. It could be like a few examples of ones that I would consider would be partially hydrolyzed guar gum or acacia fiber. You could try psyllium husk, although psyllium tends to not be as good for diarrhea. But acacia or partially hydrolyzed guar gum are two that can be quite good for helping to form up the stool and support the gut microbiome because they're both prebiotic. Beyond that, this is not the time for self-sabotage. And cautious with sugar and ultra-processed foods and alcohol and saturated fat. If you do have saturated fat, like a concentrated source in your diet, just being cautious and thoughtful about those things. And it's also a great opportunity to focus on these other factors like sleep and exercise and time outdoors to help to support our gut microbiome during this time of challenge. I view it, Scott, as like in a perfect world, you would give me at least 2 weeks beyond the antibiotic of doing these things. But like ideal would be 4. 4 weeks is around the time that it takes to really rebuild the microbiome. And then the final question, the big one that everyone wants to know is, do you take a probiotic? And it's a question that's a bit complex because there was a challenge to this idea. I used to give probiotics to everyone. And then there was a study, I believe around 2016, out of Israel. And in this study, what they found is that taking a probiotic after antibiotics slows the recovery of the gut microbiome. So for the vast majority of people, I don't actually recommend probiotics. But if you've ever had a history of C. difficile infection, or I think that this context where you're struggling with antibiotic-associated diarrhea, I think those are cases where it would make sense to potentially take a probiotic. And the one that I like, I'm going to put it into the chat box. Let me see. This is hosts and panelists. Okay, I'm going to drop it in the chat for everyone to see. Is called Saccharomyces boulardii. Okay, and you can get that over the counter, and that's really good in this context of I'm taking an antibiotic, I want to protect my gut, and I want to reduce my risk of infection. That's the one that I would use. Scott, I think you're muted.
Oh, there we are. Yeah, I was a lot of thunder here, so I was muting because we have a big storm rolling through. I didn't want to interrupt you with the
That's
lightning
okay.
thunder. A question about FODMAP diets. We have a few of those kind of in our chat.
Okay.
And so many people believe that a low FODMAP diet cures IBS, but they still can be low fiber, and it's constraining to the microbiome. The person says, I believe plant-rich foods using whole plant foods can be paired with a low FODMAP diet if this represents an issue for some people. What are your thoughts?
Yeah. So my second book, the Fiber Fueled Cookbook, I view my books as being tools for healing. So fiber fueled was basically like, let me introduce you to the gut microbiome and the approach that you can take to improve the health of your microbiome. And that led me into the cookbook, the fiber fueled cookbook, because many people reached out to me and said, I'm trying to eat this way, Dr. B, and it's actually a struggle for me. There's a reason for that. Let's get to the bottom of this. That's what that book is. It's basically tolerances and includes a section, a chapter, including about 25 recipes that are low FODMAP. So let's talk about this concept, low FODMAP. All right, so FODMAP, once again, is an acronym. These are, you pointed out at the beginning that I'm a nerd. I'm going to sound nerdier than ever right now. So FODMAP, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Basically, they are referring to the fermentable parts of our food. It's not just plants. In fact, probably the number one FODMAP is lactose, which is found in dairy products. That's the biggest food intolerance that exists across the globe. But for people who have IBS and struggle with bloating or upset stomach, difficult digestion with their meals, the FODMAP diet can help. Now, an important point, most of the FODMAPs, they're actually really good for us. So they're actually prebiotic. So we don't necessarily want to eliminate them permanently. So how do we go about this? The key here is that the low FODMAP diet does not mean that you permanently eliminate, basically anything. So if you were to eliminate dairy, I wouldn't have a problem with this. But I don't think that it's necessary to eliminate FODMAPs permanently. It's more so that it's an approach that allows you to feel better and then reintroduce these foods. To really do it the best way possible, I would recommend doing it in collaboration with a registered dietitian because there's complexity to this dietary approach. So yes, you can go low FODMAP and do it for 2 to 4 weeks, and it'll probably make you feel better, but then you got to bring these FODMAPs back in. And during that time, it may be best to work with a dietitian to do that.
Yeah, that's a really good suggestion. I found that that's helpful for people. Sometimes you have to take them all the way back to the beginning.
Yeah.
And you slowly rebuild the gut and add fiber in over time. And you're right, this is where the relationship between a dietitian and a physician is essential in helping people recover their health. This team approach to medicine is really what we should be doing.
Yeah, totally agree.
Here's the next question. I'm taking a proton pump inhibitor and have been taking it for 6 years. Recently, I worked with a nutritionist who put me on a vegetarian diet and encouraged me to drop the meds. I'm doing okay, but from time to time when I eat out at a restaurant, my gut gets very uncomfortable and my wife says to take the meds. What do you recommend?
Okay, so this is a good question, and let's first celebrate the win that I'm hearing here, because there is a win, and that is that you are a person who was on a medication called a proton pump inhibitor, and you were taking it daily for 6 years. All right, so these proton pump inhibitors, the way that they work is they basically stop your stomach from pumping acid. And that sounds like when you have acid reflux, that sounds like, hey, like that's the solution, right? That's fixing the issue. Well, the problem is that we have stomach acid for a reason. And it actually affects our microbiome. So when we remove the stomach acid from the picture, there's going to be effects on our microbiome downstream. And one of the major risk factors, Scott, for SIBO, which we were talking about a moment ago, the small intestine bacterial overgrowth, is the chronic use of the proton pump inhibitor. All right, if you want to address the root of the issue, it's not actually the acid that's the problem. It's gut motility. We need to get your gut back into a rhythm. If your gut is propelling food forward, then it's not going to go backwards. And a big part of this actually is the benefit of fiber. So it's interesting. I like, as I came into understanding these studies, I was like trying to rectify, why does this work? I'll give you my thoughts on that in a moment. But What they found in a few studies is that, number one, if you increase your fiber intake, which by the way can be both dietary and via supplements, if you increase your fiber intake, it's good for acid reflux. Number two, a plant predominant Mediterranean diet was as effective as medication for the treatment of acid reflux. Number three, if you get rid of the caffeine and the alcohol and you replace it with water, that also is highly effective for improving acid reflux. So I've now given you a couple of things here. This person increased their fiber intake. They are real world. They're sharing, validating the research for us as we sit here. And so now the problem is that you may still be susceptible. These things are not silver bullets, right? We all have vulnerabilities in terms of our health. And there are some of us who do everything right, and you may still have a little bit of acid reflux. We are so much better off that we're not using the medication on a daily basis. When you need medication on an occasional basis, that to me is like you've made a huge step towards progress. Actually, the best medication within this context is not the proton pump inhibitor anymore, believe it or not. The PPI, the proton pump inhibitor, is best when you need something every single day. In this context, actually, Pepsid can be much more effective as something that you just need once in a while. And if you know, hey, this meal, I'm going out for Italian, I'm going to have a glass of red wine. Okay, like you're setting yourself up, you know what's going to happen here. Just take the Pepsid before dinner. Don't wait until the heartburn sets in. Just take it before dinner, right? And to take this medication once in a blue moon, a few times a month, you're in a great spot. I would not feel bad about this at all.
And then the next morning, green smoothie, right?
Oh, 100%. Get that fiber rolling again.
That's right. We have a few questions, Will, about eosinophilic esophagitis. Some people have mentioned the benefits with your products, the daily microbiome nutrition. But maybe just go through EOE and how to approach it and kind of the underlying cause, because I think the underlying cause hints at a number of diseases that have that same root.
Yeah, this is an emerging health condition, and actually one of my mentors at the University of North Carolina, Dr. Evan Dellin, is one of the national leaders in this topic. And so it's interesting because like in the 90s, this barely existed. And in the last 25 years, we have seen an explosion of eosinophilic esophagitis. This is an allergic disease, which I'll explain that more in a moment, affecting the esophagus. The esophagus is probably the most simple organ that exists in the entire body because it's literally just a tube that connects your throat to your stomach. So you swallow and it transfers the food from here down to your stomach. That's it. Its job is done. All right. And the problem is that when you have this condition, these inflammatory immune cells that are known to show up when there's an allergy, they show up in the lining of the esophagus and they can cause a lot of trouble. So, and there are people who have severe eosinophilic esophagitis and it can be very dangerous actually. So, allergic means that our immune system is inappropriately reacting to something from outside of our body. So we can have allergies in our nose, like pollen, right? In Charleston, we've had this issue in the last month. We can have issues in our lungs. That is asthma, reactive airway disease. But in this case, the issue exists in the esophagus, and we think it's related to food. So typically there's a food-based trigger. Many times these people, they actually require, at least temporarily, steroids in the esophagus to get the inflammation to cool off. If you can identify which food it is that's causing the problem, then you can potentially eliminate that food and this problem may go away. So the foods that cause this issue are the same foods that frequently cause food allergies. So fish, shellfish, dairy products, eggs, wheat, corn, soy, peanuts, tree nuts, and sesame. I'm very proud of myself for getting through
Well
that.
done.
Yeah, I
Notes.
didn't study for that one, so I was like, okay, I got to dust it off for a second here. So those are the classics. And if you could identify which of those it is, then you could potentially eliminate it. Sometimes acid reflux medication actually helps with eosinophilic esophagitis. And if you were, I am not here to promote fiber supplements for this purpose. In fact, I haven't actually seen a fiber study with eosinophilic esophagitis. That said, I have seen that eosinophilic esophagitis is associated with a damaged gut microbiome. And one of the ways that we can repair and restore the microbiome is with prebiotics, diet, and potentially supplements. And so to me, this should be a part of our strategy, is to try to address the gut microbiome as a root of the issue.
And have you seen any studies that suggest, these foods often are sprayed with a lot of pesticides and herbicides? Do you think that contributes to the EOE, or is it strictly just the food itself?
Scott, how much time do we have here? you're you're cracking open a can of worms here.
I know, I know.
Well, I mean, I think we all see. So there is. Let's take. I mean, I hate that. Like sometimes people have. It does feel like emotional because it's political. Let's take that. Let's put politics to the side and just sort of acknowledge what's happening with the "Make America Healthy Again" movement. This is one of the big things that people are looking at. And as a medical doctor, what I care about is outcomes. And our country is struggling from a health perspective. And there are opportunities that we could address some of these issues that exist in agriculture. So, yes, pesticides. An example of this is glyphosate, which is Roundup. And Roundup is what you spray in your yard. And I saw a commercial the other day, Scott, where the makers, it's now Bayer, it used to be Monsanto. The makers of Roundup were like bragging in their commercial on television. Hey, spray your yard once every 4 months. You know why you only have to spray it once every 4 months? Because it's what we would call water soluble, which means that it's not going anywhere. It's in the water. So the problem is that this is also used to dry out wheat, to dry out legumes, and other whole grains. And you hear these people, and I don't think they're lying, who say things like, hey, I have wheat and bread in the United States and I get sick. And then I go to Italy and I'm fine. And they attribute this to gluten, and I understand why, because we've spent 15 years vilifying gluten as the problem. I don't think that's a gluten issue. There's gluten in bread in Italy. I think that is an agriculture issue, and specifically that there's something that we're putting on our food that's causing trouble. And so, and I think the same could be true. Like, Stephen Gundry has made $1 billion talking about lectins and beans and the problems that exist there. There's not a problem with beans, but there is a problem when we're spraying beans with these chemicals to dry them out. So it's just something for us to be aware of, and this is why I tend to opt for, with these things, whole grains and legumes, I opt for organic when possible.
Yeah, well said. Absolutely. Gosh, I have so many questions, but one quick one while we're talking about lectins. You want to just comment on oxalates too, because that's a big one. I have patients coming in now and saying, oxalates are such a problem. They're not going to eat plants because of oxalate injury and inflammation.
Yeah, it's been hyped up. It's not, I don't think that there's really substance to back up this entire issue. There are some people who have oxalate intolerance or sensitivity, and they're at risk for developing, for example, kidney stones. And so the solution to this issue is just to be conscious and aware of like how much oxalates you're allowed to eat for that particular person who has a history of kidney stones. You would talk to your doctor about that. And then it may lead you to being cautious about, like, for example, putting spinach in your smoothie every single day. You might not do that every single day,
Right.
right? But does that mean you have to eliminate spinach entirely? Can you never have spinach? I would not argue that. Like, I don't think that's actually true for the majority of people. The concepts of oxalates being inflammatory inherently, to me, has no scientific merit, because we're talking about things that are widely pervasive in our food system, found in plant-based foods, and there's overwhelming evidence on the benefits of plant-based foods on so many levels, including for our gut and digestive health.
Right. Yeah, that's right. And while we're on that same topic of things that are trendy, we have a couple of questions about microbiome testing. This is another big can of worms, right? And huge marketing push to have your microbiome tested, followed by, precision probiotics or some intervention.
Yeah. All right. So let me, I guess, unpack this for a moment. So, generally speaking, I would not characterize microbiome testing as ready for prime time. Generally speaking, because any doctor who says they know what to do based upon that test, I would love to see the study that they can cite to support that. That's the issue. Is it interesting? Yeah. Like, do I find it compelling to think about? Yes. Does it change anything for me as a gastroenterologist? No, because the things that I'm looking at are your symptoms, your health history, and your bowel movements. And you give me those three things, all of which are free, right? You could just tell me right now, like, how are your poops? How are you feeling? And what other medical issues are you dealing with? Because if I see a pattern of a lot of health conditions that are associated with dysbiosis, I think that says something. If I have that, that's what I really need to know what's going on. All right. Now, there's a caveat to this, and I have to be totally transparent up front that I'm the medical director of a personalized nutrition company called Zoe. And Zoe offers a microbiome test. There's a few thoughts that I have with this. First of all, we are a unique company. We have scientifically validated with a randomized controlled trial that was published in Nature Medicine that shows that by following the Zoe program, people experience health improvements and health benefits, and there's a number of them. So I feel it's a little bit different when you have a clinical trial that's published to back up what you're actually offering to do for people. But the second thing is, like, we're not just a microbiome test. There are many other layers to what Zoe does that goes beyond the microbiome. So I guess my point is that when you hear me say, I don't think microbiome tests are ready for prime time, I want you to also understand, like, that doesn't apply to Zoe, but Zoe also to me is not just a microbiome test. I'm not inserting that into that category.
Yeah, great. Thank you. And we have a number of questions, Will. I'm trying to summarize some of these because we have a growing queue of 60 questions now.
Oh dear, I gotta go rapid fire here. I'm sorry.
No, you're doing great. I think
a full explanation on SIBO, all the details.
No, I honestly think it's better to teach through this than just to answer the question, because we all, once we're empowered with an understanding, we can contextualize other things that we see. But we have a number of questions on IBS. We have IBS as a vegan struggling with SIBO, but also IBS.
Yeah.
Number of ways to treat and manage IBS and how to resolve that. And IBS with diversity of plant fibers over time. So maybe you can kind of unpack all of that and just do a few minutes on IBS in general.
Sure. IBS, once again, another acronym, is irritable bowel syndrome. All right. Now, the important thing from my perspective as a gastroenterologist, and I want people to hear this, is I don't yet, you can say I have IBS. I don't have enough information to understand what's going on yet, because we have to break this into main types. IBS with constipation or IBS with diarrhea. There tends to be a pattern. In order to be diagnosed with IBS, you have to have a change in your bowel habits. It's not just pain. It's pain and a change in bowel habits that tends to be either mostly constipation or mostly diarrhea. So, and the key here from my perspective is, like, let's start with this, because the way that I approach this issue is going to depend on where we are on that. These are polar opposite things. All right, IBS with constipation. If I can get you pooping, your IBS will go away. Now, that may sound super simple. It's not always simple. Sometimes there's nuance to constipation. I like to start with fiber and gentle exercise, like taking a nice brisk walk in the morning, hydrating, drinking some water, And for people that have mild constipation, that will fix it. But there's going to be many people, the people that tend to come to gastroenterologists, who they need more than that. I like magnesium supplements, and in combination with oftentimes fiber supplements. Those two things, they pair well together. But the last thing is, like, sometimes there's other things that could be going on. So just be aware. Sometimes diagnostic testing is necessary. Sometimes colonoscopy is necessary. Sometimes other testing is necessary. So just be aware of that. And then IBS with diarrhea. Okay. So before I accept this diagnosis, before I say I agree you have IBS with diarrhea, I want to do a thorough evaluation to make sure that we have really ruled out the potential causes of chronic diarrhea. And that can include infections, including chronic infections, including parasitic infections. That can include celiac disease. And it might also include certain food intolerances. So, like, there's a health condition called sucrose intolerance. Sucrose is table sugar. And you could be actually like really strict about your diet, and you'll still have sucrose in your diet because there's many healthy foods that include this, like sweet potatoes. So, so I guess my point is that when you have IBS with diarrhea, step number one is a good, thorough diagnostic evaluation to make sure that we haven't missed anything. So that's the way I would approach that. And fiber supplements can help with. Here's the beauty of fiber. The beauty of fiber is that if you have constipation and I give you too much laxative, you'll have diarrhea. If you have diarrhea and I give you too much anti-diarrheal medication like Imodium, I could make you constipated. That's a roller coaster. We don't want a roller coaster. We want like just nice and steady, consistent. And that's where fiber can come in handy, because fiber is the one thing that, whether you're constipation or diarrhea, it helps to bring you back to the middle. And that's a beautiful thing.
Yeah, that really is a beautiful thing. The power of plants, right? They solve so many problems.
Yeah, well, you know, it's I think a big part of it, Scott, is that these issues, they involve motility and the way that our intestines are moving. They involve the gut microbiome. And so fiber is something that addresses these issues at their root. It addresses the motility, it addresses the gut microbiome. So you're actually just restoring normal.
And if somebody, we've had a couple questions in the queue, if somebody's struggling with motility issues, gastroparesis, how do they interact with fiber and those conditions? And can you actually reverse those or heal them?
Gastroparesis is a complex, challenging issue. If you have diabetes, we need to control your blood sugar as much as possible. I want to get your hemoglobin A1C like certainly below 7, ideally below 6. That's a big part of addressing gastroparesis. If you have underlying constipation, treat the constipation, because constipation causes gastroparesis. When the colon and the stomach are connected and talking to one another. So when the colon is stuck, it will tell the stomach there's no room. And this is why many people that have actually constipation, they get full quickly, or they get mild nausea, and they can get gastroparesis. So address the constipation if that's the case. And then I guess the last point is that people are often told to go low fiber. And I would argue that that is true for like things that have a thick skin. All right, like whole foods. But if you can break those foods down, such as in a smoothie, they are completely fair game. So just be conscious and aware that like a raw salad, although we generally think raw salads are really good for us, in this context, it may actually not be good with the stomach because it'll just kind of pile up and accumulate. But if you took that raw salad and you homogenized it in the blender, you're good. You can enjoy that.
Yeah, the smoothies are a great way to get nutrition in, and do so in a gut that is challenged, right?
Yeah, I'm a big believer in smoothies. I think, as I said in the beginning, that's how I got started. So you'll never be able to convince me otherwise, because that was my on-ramp into this lifestyle.
Yeah, we actually have a question. That was my next question for you. So that's a perfect segue. Somebody said, I remember your story that your girlfriend, Valerie, now your wife, turned you on to smoothies. And I'm
Yep.
wondering who turned her on to plant-based eating.
She turns herself, my wife is a highly intelligent person, and when she was 5 years old, she's also highly compassionate. And when she was 5 years old, she discovered what they do to cows. And this upset her, and upset her enough that she went home, and then her family stopped eating meat.
Mm,
And so
wow.
this is how my wife started. And then I think that my wife, over time, she became very interested in not just the ethical side of these things, but the health and wellness side of things. And she was reading books by many of the legends that you're friends with. Um, so like I remember when we were early days dating, and we'd be in the car listening to a Joel Furman book. So yeah,
That's great. I love it. It's the
G
foundation
bombs,
of
G
your
bombs.
family. That's wonderful. G-bombs. That's exactly right.
Good old like 2009 Joel Furman.
That's great. We have about 15 minutes left. I want to address autoimmune disease. And so we have a question about this person's eaten whole food plant-based for 4 years, lost 32 pounds, had amazing success with reductions in cholesterol, triglycerides,
Yes.
um, but now have numbers in high numbers in peroxidase, Hashimoto's, and is wondering kind of what happened and how they can begin maybe turning back the clock there.
So it sounds to me like, in general, this person's diet. I mean, obviously, I don't know the person. All I know is what we were just told, right? But if it were me, I would take a step back and I would say, I don't think that the diet is the problem. And I would open it up to a broader view of where are the other opportunities. We kind of discussed this a little bit, but like we live in a society where we have bright lights at night. We're not allowed to sleep, right? We're getting ticked off because of what's happening on Twitter, and you get 6 hours of sleep, and then you wake up in the morning, so you over caffeinate, and then you go straight to work. You spend no time outdoors. You don't see the sunlight at all, right? Like this is the world that we currently exist in. This is what we have normalized. This was never normal. Our grandparents, like this is not the life that they grew up with, right? And so I think that like trying to, for me, Scott, with the concept of like autoimmune, um, I, don't get me wrong, there are genetic predispositions that will exist. In no way would I suggest that a person has made mistakes or that this is their fault, right? But we want to control what we can and give ourselves the best chances that we can. And so to me, yes, diet is a part of it. Fiber and omega 3s and polyphenols. Um, and I would argue also fermented food. Those are the things that I would focus on from a dietary perspective. So, like, I guess fermented food, if that's not being done, there's an opportunity. But then also, let's think about like what was the world like for humans for 99% of human history relative to where we are today. And let's try to restore that order on some level. So that means that we get exposure to morning sunlight, we get outside, we take a walk outside, that we make sure we get a good night's rest, that we're consistent with our meal times, we're consistent with our bedtimes, we're making sure it's at least 8 hours of sleep at night. We have a wind down protocol at night. We have an early dinner. Like these are the types of things that we exercise, human connection, spiritual connection, opening up our heart to a higher power. These are all things that I think are quite important these days.
Yeah, that's beautiful. And we actually had a few questions about how do you rebuild your gut microbiome? And I think you just summarized that quite effectively in that commentary. It's the lifestyle, it's the diet, and it is really working on, controlling your environment and rebuilding your environment. It's returning to where we were 200 years ago.
Yeah, that's right. And I guess the last thing you touched on this actually, and I want to bring this forward a second time, which is that stress and stress. So there's different forms of stress, and in many cases, stress can be good for us when it makes us stronger. Exercise is stress, But there is such a thing as overwhelming stress, which is more than we can handle at a particular time, and that can be traumatic. That's trauma. If many people have dealt with trauma, and if there is something that happened that hasn't been fully dealt with, that emotional wound that exists, perhaps in the non-conscious mind, you might not even be thinking about it, that can actually disrupt the gut. And then the other thing is there's this balance that exists between the sympathetic nervous system, which is our get up and go nervous system, and the parasympathetic nervous system, which is our rest and digest nervous system. And our society is sympathetic dominant. We're always going. It's hustle culture. It's getting triggered by things. And what we need to do is we need to shift the scale of balance towards parasympathetic, which is slowing down and spending time in nature and spending time holding a person's hand or giving a hug or paying someone a compliment or spending time in the Bible, or listening to music, and there's a lot of options. There's a lot of options, but many of the things that we don't really do anymore, it turned out that those things, when they've studied them, they actually activate our parasympathetic nervous system. We should be doing them more.
Yeah, that's beautiful. Thank you. One question I just wanted to pitch in there is because it's such a big issue today, is the effect of ketogenic and carnivore diets on the microbiome. And so many in that field would say that it doesn't affect the microbiome. So maybe just 2 minutes on that one, and we'll finish with a couple of just 2 minutes.
You can't, Scott, you can't set me up like this and not let me do the slam dunk. But I guess okay.
Slam dunk. We got time. Go for
Everything affects the microbiome. Everything affects the microbiome. Everything affects the microbiome. So there's that argument to me is there's no merit to that argument. And the problem is that we know with clarity that when you totally eliminate plant-based foods, the changes that occur to the microbiome happen very fast, and they're not good. They're not good. So actually a 2014 study in Nature Medicine, they looked at this. 5 days of plant-based, 5 days of completely animal-based, zero plants, zero fiber. And the 5 days on the completely animal-based diet, like I would characterize it as disturbing. So we had more Bilophila wadsworthia, more Allosteps putrescens. These two microbes are associated with colorectal cancer and inflammatory bowel disease. That's not the kind of microbiome that I'm looking to build. And it's kind of scary that in just 5 days, like you already start to see this.
Yeah, I think that's a good summary of why plants are powerful, right? I think it would be interesting because we had a number of questions on, we had one on relationships. So I was thinking generally, if we could just talk about, the relationship of the microbiome and the different systems in the body. We had a question on microbiome and infertility. So maybe if you could just, I think it'd be fun, just a head to toe of microbiome and brain microbiome and joint microbiome and infertility, just because it's so fascinating and it's truly exciting to see the opportunity.
Okay, so we, in terms of our brain, there's the brain-gut connection. And so we know that with clarity, the gut is communicating to the brain is talking to the gut, and they affect each other. And so I mentioned a moment ago, stress causes dysbiosis. That's the brain-gut connection. But the flip side is also true, which is that the gut can actually enrich the brain or disrupt the brain. And this is part of the reason why we see that mood disorders, as well as cognitive disorders like Alzheimer's, Parkinson's disease, are associated with changes in the gut. It's kind of interesting, actually, that the new theory on cognitive issues and also many psychiatric issues is what we call neuroinflammation, which means inflammation inside the brain. And there's a strong argument that our gut is the opportunity that we have to remediate that. And this is why, for example, you can eat a Mediterranean diet and improve depression. So, all right, moving down, the oral microbiome. Actually, it's interesting. Our oral health is quite important. We have a separate microbiome right here in our mouth, and it's connected to gum disease, periodontitis. It's connected to halitosis. What was that, Scott? Sorry.
Oh, heart disease too.
Yep. So the oral microbes are connected to heart disease, and the oral microbes are also connected to colorectal cancer. So, like for example, there's a bacteria that's been found in about 50% of colorectal cancers that it's not from the gut; it comes from the mouth. So anyway, so this is an argument to go see your dentist. Um,
And
and
does
then
fiber feed those? I mean, the polyphenols in fiber in plants, does that optimizes the oral microbiome, correct?
the answer is yes, because the alternative is also that sugar, right? Like, so we've sort of accepted that sugar is problematic in the mouth, and it happens like this, so quick, right? You just chew and swallow, but during that short period of time, you got to keep in mind what is seconds for us could like feel to these microbes like months or years. Because like in 15 to 20 minutes, a new generation of them is going to spawn. So just chewing in your mouth for a short period of time, that level of exposure to the polyphenols and fiber may be enough. And I think also the gut microbiome has a say as well. I think there's connections that exist there. So, all right, we could go organ by organ, but I'm gonna go system by system to keep it a little bit simpler, which is to say that our gut is powerfully connected to our immune system. 70% of our immune system is actually residing in the lining of our gut. I would argue, we've been talking about this a little bit, autoimmune and allergic health conditions. Every single study that I've seen where they look at the gut microbiome, there's a damaged gut microbiome for those conditions. The gut is powerfully connected to our metabolism. That means, so like some of the things, blood sugar control or blood fat control, that's our cholesterol or our lipids, or blood pressure or satiation, feeling full after a meal. These are things that we've kind of lost.
Mhm.
And so, like, we shouldn't have to count calories. You should be until you're full, and then you're full. You wouldn't eat anymore because you're full. And that's not where we are with ultra processed foods, and that's the problem. And that's a whole nother conversation. All right, the question was about fertility. So, our gut is in fact connected to our hormones. For women, there's something, actually, we have a special name for the gut microbiome that plays a role in the balance of estrogen. We call it the estrobolome. And so the gut microbiome actually has an important say in what estrogen ends up getting pooped out and what estrogen gets reabsorbed back into the body. That's important, particularly as we age. I'm sure many people have noticed perimenopause and menopausal symptoms are, I think, a lot more prevalent today than they used to be. And I don't think that's just that people are being more open about it. I think that this is a real issue. And I think the big part of this is that we've lost our gut health. And so our estrogen balance is not where it needs to be. There's research, by the way, real quick, for women who are suffering with those issues, that improving the quality of your diet can help to reduce those symptoms. So, and then for men too, testosterone levels. Testosterone levels are strongly connected to our gut microbiome and gut health. So, and this explains why, like, if you want to motivate men, I would focus on talking about erectile dysfunction and how that's connected to our gut health. That's how you get guys to eat fiber right there. So, anyway, so I think that has basically covered the issue. Our immune system, our metabolism, our hormones, our mood, our brain health, and what's left is, of course, our digestion. We've been talking about that. And then the last thing is our genetic expression. There's ways in which, like, our genetics are not a pre-programming for disease. Our genetics are instead a switchboard. And those switches can be flipped on or off. And it's the microbes that have an important say in that.
Incredible, isn't it? This relationship that we have with these organisms that are not us. It's a powerful story of community.
Well, I think it brings us back to the holistic nature of our body, right? Because we built a healthcare system that has progressively become specialized by demand, because there's, in your field and in my field, there's hundreds, thousands of new papers on a daily basis. So we have to specialize, but the problem is like the big picture view is what really matters, seeing this whole thing. And I think the other thing is that it actually brings me back to seeing that we're not um, living these independent lives. We are connected. We're connected to our environment, to our nature, to everything around us. We may think that that those things don't matter anymore. No, they're more important today than they've ever been, actually.
Yeah, that's exactly right. In our healthcare system, we believe hyper specialization will solve the problems, but it leads to, in some ways, greater levels of disconnection, in the greater sphere of the whole. So,
Yeah, I think so, because I think that part of the problem is you go to a doctor and they say, well, that's not my issue.
yeah, I always tell the story. I had a patient that saw a hand surgeon, and they said, I have an elbow problem. They said, well, I don't deal with the elbow. They're a doctor, it's connected to my wrist. Like, yeah, you have to go see the elbow specialist. So, uh,
Yeah, exactly.
a couple of quick questions as we kind of wrap up. Colonoscopies and effect on the biome. And do you need to rebuild your microbiome after colonoscopy?
So I'm a big proponent of colonoscopy. And the reason why is because of my experience as a gastroenterologist. There is nothing more heartbreaking than to have to sit down with a person who you know has a family and to have to tell them that they have colorectal cancer. And it has shifted to a younger population relative to where it was just a few years ago. So we're diagnosing more people in their 30s and their 40s than ever before. The data back that up, by the way. Eating a plant-based diet, even if you are perfect by all measures in your diet, it still does not offer the protection that you need. Colonoscopy is still important. I just want to share that my action is where my mouth is. When I turned 40, I got my first colonoscopy. Why? Because I wanted to know that I was safe. And we have a family history of colorectal cancer, so I just wanted to know that I was safe. Um, with the gut microbiome, please don't allow this to be a reason to not get a colonoscopy. It is something where yes, there is a perturbation, like you do perturb the microbiome, and then it rapidly recovers. It's not the same as suppressing it on a daily basis with antibiotics twice, 3 times a day for 7 days or 10 days or 14 days. It's not the same. It's a single day. You flush out, your microbiome recovers. Many of the things that we discussed of how you approach antibiotic use, I would argue the same concepts are true when you have your colonoscopy. Just support your microbiome during this time.
Beautiful, thank you. And last one, just a mention on alcohol and the effect on the microbiome.
Oh, man, I thought I could get out of here and not be a party pooper, but now here I am and I'm going to ruin it for everyone. All right. So I think, first of all, excessive alcohol consumption with total clarity is bad for the microbiome. Um, and I would argue, based upon what I've seen, that a hangover, if you drink to the point of having a hangover, that is not dehydration. If it was dehydration, you could drink a Gatorade and you would bounce right back. There's something deeper that you have done to your body when you need 48 hours to recover. And I think that the gut microbiome is, in fact, the story there. There was a study, Scott, that I came across in the last few years that has changed my perspective on alcohol, to be honest with you. So there's been these studies, I'm sure many people have heard, where they say, well, having one drink a night is actually good for you. And the problem is that these are epidemiology studies, which I have a background in epidemiology. I'm a big believer in epidemiology. I'm not one to dismiss epidemiology. But the problem is that the person who has a glass of wine every night is also the person who tends to go to the gym and eat a more clean diet. And so there's an association that is really hard to get under control. The healthy user. More recent studies have called this into question, where they've got better control over the healthy user bias and discovered that the alcohol benefits, they disappear. But the study that changed everything for me, Scott, was where they took a group of people and they, it's an interesting study to sign up for. Basically, they got them drunk. And then in the period that followed, every 30 minutes, they would check their blood alcohol level and they would check something called the lipopolysaccharide. And lipopolysaccharide is something that actually comes from harmful inflammatory bacteria. It's not supposed to be in your blood. And when it's there, it basically means that your gut barrier has broken down.
Mm.
And so they were checking these two things every 30 minutes. And basically, you could see the ramp where the blood alcohol level went up. And in parallel, the lipopolysaccharide level went up. And then you could see where the blood alcohol level peaked and it was coming down. Well, literally at the exact same time, the lipopolysaccharide level peaked and it started to come down. And then you could see that the blood alcohol level took some time to normalize and return to zero. And the lipopolysaccharide level did not return to zero until the blood alcohol level did. So does that prove, is that, like certainly Scott, with your background, you could challenge me and say, well, that's not one drink, right? And that would be true. That study was not just one drink. But that study put enough writing on the wall for me that I've said a detectable blood alcohol level, where is the benefit?
Right.
So I'm of the belief that we are better off not having a regular alcohol habit. It also, by the way, independent of this, is really bad for our sleep. It's the worst thing you can do for your sleep. So to me, we're better off not having the habit. If a person, like I will still enjoy a social alcohol beverage, but like it's a uncommon thing at this point.
Right. Yeah, thank you. That was a great summary. I have a question for you, Will, but I'm going to ask our attendees too. If you've learned something this evening about prebiotics, probiotics, your microbiome health, our question just to pop in the chat, because we all like to see what you've learned. What changes, if any, are you inspired to kind of make based upon this evening? We'd love to hear your feedback. And so the last thing for you, Will, is just kind of a general, you've worked with 10,000 people and you are such a fabulous communicator. And I really appreciate the fact that you communicate with a lot of empathy and compassion. And so I guess my last question for you would just be, what would you like to say in an encouraging way to somebody that's on a journey, making a life transition? Maybe they've had struggles, and they want to continue on this journey of transforming their life through healthier diet.
I would approach this the same way that I would if I were sitting across from a person in a clinic, which is that I would sit down at their level and look them in the eye, and I would want them to know that I'm going to meet them where they are, and where you are today is not like you shouldn't feel any shame whatsoever, because I can promise you my diet was worse. Like I had the worst diet on the planet. All right. And I suffered the consequences of that. And I think that my personal journey is a testament that small choices, when implemented with consistency, they really add up. And I think that this concept of like healthy habits, making that small choice on a consistent basis, Scott, it's reinforced in the gut microbiome. The data are clear. Like, in fact, there was a study. I know I'm being a bit tangential. I've lost track of like sitting across from the person and talking to them, but I just want to share this real quick. That I think most of the people here will enjoy this. That actually at Zoe we did a study, and we asked the question of all of the things, because we have 200,000 people and we know what they've been eating and we have their microbiome and we have all this data. And so we asked the question, what is the number one food for like making a change in the gut microbiome? Do you know what the answer is, Scott, out of curiosity?
No, tell me. I'm curious.
It was coffee. It was coffee. Is it because coffee is better than a kale salad? No. It's because if you are a coffee drinker, you do it every day. And it's a consistent habit. And on day one, if you were never a coffee drinker, you have that first cup of coffee, it's a little change. But then you do it on day two, and day three, and day four. And those little changes every single day are nudging your microbiome in a certain direction. And next thing you know, it's been 30 days and you've made a radical change. And so what I would really encourage people is think about consistency think about small choices, feel good about yourself, and don't worry about some vision of perfection. I just think that that's a turnoff. I think instead, like, start where you are today and focus on progress, because when you make progress, that's a win, and you should feel good about that.
That's right. Thank you. Celebrate every win and every day, right? It's a gift.
Absolutely.
Wow. Well, this has been fabulous. I wish we had a few more hours, but you have a family. I do value your time greatly. And if you enjoyed, Will, you please join us at the PBNHC this year, again, September 5th through 8th. And it's not only for healthcare providers, we have a consumer track as well for the general public. Dr. Joel Furman, as you mentioned, Will, is going to be there with his daughter. And Ocean Robbins is also going to be there doing something for the general public. So it's for everybody. We try to open it up. We want to build community. And you can come and see Will in person. And Will, I just really want to appreciate your gift of time and just your gift of education. You are a fabulous communicator and a gifted educator, not only a scientist, but you truly are. You connect with people in a very meaningful way. So thank you.
Oh, I appreciate that. And I appreciate some of these nice comments that are showing up in the chat that I can see here. And I just want to thank everyone. And I just want to reiterate, actually, it's really special to get to connect with people in person. And I believe in the power of human connection. Like, this is one of the things, like, the average person in the United States, adult, spends 6 hours a day on their phone, right? And then we say we're too busy.
Right.
If we got rid of that 6 hours, you'd have plenty of time to, like, sit down and enjoy a delicious meal or to have coffee with a person. And like this, to me, coming to an event like this where you know I'm going to be there, it would be awesome to see everyone there and we can hang out. And I would love to chat and hear more about your personal story for each of you.
Yeah, wonderful. Thank you. So please join us, pbnhc.com. And if you've appreciated what we're doing with Plantrician Project, we try to do as much as we can and make it available to as many people. And it's a not-for-profit that makes these offerings available to you. So if you appreciate what we're doing here, you can go online, plantricianproject.org/donate, and you can support Plantrician. Every gift helps us grow a healthier world, one provider, one patient at a time. And so thanks for joining us tonight. Thank you, Will. Tell your wife and your children thank you for their gift of time that they've given up from you. And I really look forward to having a good cup of tea with you at the conference.
Sounds great. By the way, the tea counts just as much, Scott. So you're okay. Don't feel bad about tea versus coffee. Decaf, by the way, is just as good as well.
Yeah, my ginger turmeric tea. So great.
There we go. Boom.
Awesome. Well, have a good night, Will. And thank you, everyone. God bless. Have a wonderful evening. Bye-bye.
Thanks, everyone.